Good afternoon, everyone. My name is Dr. Christopher Rodriguez. I'm the director of the D.C. Homeland Security and Emergency Management Agency. Wanted to give you a brief operational update on our response efforts to the COVID-19 virus. Today, we received verbal confirmation that our request for National Guard support will be approved later today. Formally, with signature from the Secretary of the Army. We have requested Guard assets largely in 5 categories of support to our COVID-19 efforts. The first is logistics. Second is security. The third, the National Guard has a medical unit, which is 15 people strong. Planning and distribution of commodities in the future. What I wanted to note is that the National Guard has been a great partner to our efforts at COVID-19 already. Since the mayor activated the Emergency Operations Center at the D.C. Department of Health a little over a week ago, the National Guard has been in the EOC supporting our planning efforts. And this afternoon, we did receive additional personnel from the National Guard to help us in our planning efforts for COVID-19. So we do expect over the next few days for the Guard to deploy an initial re-upping of personnel of about 30 people to our operations and our response efforts. The EOC will remain operational at the D.C. Department of Health for the foreseeable future, and it will continue to coordinate operations and requests from district agencies to make sure that we are constantly staying ahead of the COVID-19 response under the mayor's leadership. And with that, I will turn it over to Mayor Bowser.
Thank you. Good afternoon, everybody. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by members of my public safety team to provide you with some information concerning our members in both our members specifically at the Fire and Emergency Medical Service who have been impacted by COVID-19. Before doing that, I want to also update you on a few numbers. First, as you know, we are reporting numbers out each evening at about 7 p.m. And as of yesterday evening, we had 39 positive cases. We will add to that this evening, in one particular that the chief will brief out on. Moreover, we have been tracking and will begin reporting in the evening on the number of unemployment claims that we are receiving at our Department of Employment Services. And since Monday, we have approximately 7,600 DC workers who have applied for unemployment benefits. Want to use this time to also remind them to go online is the best way to get through. As you can imagine, our call volumes are very high, and you can apply online at your desktop, and we recommend using Internet Explorer to do that. I also want to advise everyone that we are working in coordination with our regional partners and federal partners. And over the course of this week, I've had discussions with the nation's governors, with the nation's mayors, and participated in various calls with the White House. Those conversations have focused largely on how the federal government can be helpful in supporting local jurisdictions and what local jurisdictions, those things that we cannot do. And that largely involves how are we getting access to supplies, and making sure that the nation's supply chains around very critical items related to testing, in particular, the testing materials that will support our hospitals and any local testing that happens. Protective gear not only for our workers, but also for our hospitals. So we continue to have those conversations. We also began more conversation with Governor Hogan and Governor Northam. There was some technical problem. We hope to all three be on the phone in the coming days. And certainly Governor Hogan and I had a good conversation around what he's seeing on the ground in Maryland and what we are seeing on the ground here. So with that, I want to turn to Chief Dean to talk to you once again about our members who have been impacted by COVID-19. But I also want to assure members of the public that we so rely on our first responders, our fire and EMS, our Metropolitan Police Department, our human services workers who are out in the field, our DOC workers who are reporting to work each and every day, and certainly all of our medical personnel. And part of the reason that we're so focused and that we have gone through pretty substantially drastic measures to contain in our city is to make sure that we blunt the spread of this virus, and we especially blunt it to protect our first responders. What you're going to hear from what the chief has to say is just one first responder being impacted has a ripple effect in our entire service. So the things that we can all do as Washingtonians is heed the calls to stay at home, especially if you are a senior, especially if you have an underlying ailment, and let us blunt this curve in our city. But right now I want to turn to the chief, our fire chief, Gregory Dean.
Thank you, Mayor. So the health and safety of our residents and our members is my top priority. So I can confirm for you that that we've had 3 members that have tested positive for COVID-19. The members who had close contact with either of our presumptive positive members are being contacted by DC Health for follow-up on their symptoms and any testing that may occur. Now, the number I'm giving you is 141, and that's the members for the first 2. We were just notified an hour ago that we had a 3rd member that has been tested positive, and we do not have the numbers on what the spread of that is right now. DC Health is also contact tracing all patients that are presumptive positive members treated are transported to the hospital when they were in their contagious phase. The department has implemented infection control group that is working very closely with DC Health so that we can assist them and monitor and evaluate our members. But the important thing is, so what can the public do to help us? If you are having a cough, sore throat, fever, stuffy, runny nose, those are considered non-life-threatening, and we would ask that you contact your doctor, your clinic, and talk with them versus calling 911 and exposing yourself, our members, and the hospital staff to this. If you're having a life-threatening event such as breathing or shortness of breath, then we suggest you call 911. And to the men and women of the DC Fire Department who have volunteered to backfill all these members that are out, I must tell you I'm extremely proud of you for taking care of your community, and thank you very much. With that, I'd like to introduce Chief Newsham.
Thank you, Chief Dean. Thank you, Mayor Bowser. I'd like to first begin by thanking the healthcare professionals and first responders who stepped up and answered the call to continue to proudly serve the community during this extraordinary time. I know I speak for all of those that are standing behind me and throughout the community when I say that we are truly grateful for your service. During this public health emergency, the Metropolitan Police Department is open for business and will continue to provide police services to the community. Our priority will be to continue to ensure that our residents and visitors are safe. To accomplish this, we must first ensure that our first responders are properly equipped and have all the information they need to ensure that they remain healthy during this emergency. Like the rest of the community and our partner agencies, MPD has implemented a variety of sensible safety precautions and temporary adjustments to some of our policies and procedures for the safety and well-being of both the community and our officers. We've issued a number of communications, including an internal intranet page for our members to ensure that their questions can be answered as quickly as possible. The page also ensures that members are aware of the various preparations, available resources, safety protocols, and all the temporary changes to procedures. As we began to make preparations back in January, we distributed an initial allotment of supplies such as gloves and masks and hand sanitizer to district stations and cell blocks. We also increased the frequency of cleaning at MPD facilities. Since then, we have also ordered a number of supplies such as masks, goggles, face shields, and disinfectant wipes for our members. Last night, we received a substantial additional amount of supplies, including masks, which were then distributed to officers and other members in public-facing roles. As other supplies arrive, we'll continue to quickly distribute them to our members. As it pertains to the current status of our members, we have no MPD members who have tested positive for COVID-19. We will continue to monitor our members who have self-quarantined due to potential exposure or other identified risk factors. Yesterday, we issued a list of temporary adjustments to some of our procedures that were made to keep the community and our officers as safe as possible and help mitigate potential exposure during interactions. We ask, when possible, community members please consider filing police reports online for non-emergency incidents that do not necessarily require the presence of an officer. There is a link on our website that outlines the criteria for filing a police report online. We are also working with the Office of Unified Communications so that calls for non-violent incidents can be routed to a special telephone reporting unit who can take the report over the phone. These reports will receive the same extensive follow-up as any report that is taken in person. We've expanded the list of the type of calls eligible for having reports to be taken over the phone. That information is available on our press release. If you are calling for police services and you are experiencing flu-like symptoms or symptoms consistent with COVID-19, including fever, cough, and shortness of breath, we ask that you please notify the call taker so that first responders may take appropriate safety precautions before their arrival. When officers arrive at your residence or location, they may request for you to come outside for an interview, when possible and when practical. For your safety and ours, we will try to maintain a distance that is consistent with public health official recommendations. We appreciate the public's cooperation during these interactions. You may have also heard that the D.C. Superior Court has restricted court operations. As a result, MPD has, in consultation with the U.S. Attorney's Office and the Office of the Attorney General, expanded criteria that officers will use to determine which arrestees will be released on citation pending a future court date. I think it's important that you know when a person is arrested and released on citation, they sign a notice to appear at court at a subsequent date, and then the case will proceed as normal. As part of our important mission, and even amid this public health emergency, we will still sometimes be required to take individuals into custody to ensure the safety of others in our community. We don't take that responsibility lightly, and we have implemented sensible procedures and safety precautions. In those cases of arrest, if the person appears to display symptoms, they will be transported directly to a hospital for further screening to ensure that they do not come into contact with others. The medical staff will evaluate the arrestee and determine whether quarantine is required. When they're subsequently placed in the custody of the Department of Corrections, they will be screened again, and if necessary, will be kept apart from others for everyone's safety. Additionally, today we finalized a contract to provide medical personnel who will screen all arrestees when they are brought into our district stations. We're in the process of finalizing the logistics and resources and implementing those procedures. My team and I are in regular contact with Director Quincy Booth at the Department of Corrections. They have also implemented necessary safety procedures for the safety and well-being of arrestees, inmates, and Department of Correction personnel. I'm told that thus far, no Department of Correction personnel have tested positive for COVID-19. The safety and well-being of the community and our members remains a top priority. We will continue to keep both the community and our hardworking members updated with the latest information. While all meetings and events scheduled to be held at MPD facilities have been temporarily postponed, we will continue to be available. We encourage you to visit our website at mpdc.dc.gov for all phone numbers and contact information for our district stations, patrol officials, and community outreach coordinators who can help you with specific police-related questions. As always, please continue to call 911 for any emergency. While the current health emergency has required us all to adapt, the members of MPD will always be here to help. We appreciate your cooperation and understanding during these times. I'm going to ask the mayor to step up, and we can answer any questions that you all might have.
Tested, and if so, do you know the results of those tests?
Let me ask Kevin to speak about DCJ operations.
There are approximately 65 individuals who have been quarantined as a result of a U.S. Marshal in Superior Court had becoming a testing positive. We received notification from the U.S. Marshals of that and the Superior Court Chief Judge recently, and based on contact tracing, we quarantined about 65 individuals. There are 2 other individuals who are cellmates, one of whom has tested, and those results are pending. Out of an abundance of caution, both those cellmates are also in their own area and kept away from other inmates for now.
So the 65 are court employees, not inmates.
Sorry, the 65 individuals, if I made a mistake, 65 individuals are inmates of the DOC. Who, based on interactions at the Superior Court building, have been deemed as individuals who were in contact with the U.S. Marshal who tested positive for COVID-19.
Where they are inmates, so they're not in quarantine then?
They are 65 individuals who are in quarantine, meaning that they have their own space and their own cell, and they are in quarantine as a result of a U.S. Marshal at Superior Court building who tested positive for COVID-19.
So has there been any cleaning of the cell? We heard about that they took some people out, but they haven't cleaned the area.
The DOC has increased their cleaning routine at the cell blocks, and the individual cells where the 65 individuals were at prior to quarantine have been deep cleaned as well.
Chief Dishon, I have a question for you. I noticed in your directive, as far as citation releases are concerned, that the officers are supposed to talk with a supervisor first to determine whether or not it should be a citation release. Is there any discretion upon the officers as far as the citation release, or will all come from supervisor? And I have a part 2 question.
No, it's laid out very specifically, and the idea of having a supervisor review it to ensure that we're staying consistent with the policy that's been developed. This is a policy that was developed based off of Chief Judge Morin's order for the prosecutors and the police department to get together and expand the list of offenses that are eligible for citation. So this has been cooperatively agreed upon by the police and the prosecutors, and the supervisors just there to ensure that we don't release somebody who shouldn't be released, who could potentially be a threat to the community.
All right, and then I noticed on the lockup list today, there's only 51 lockups. That's a fairly low number for C10. Can you say that there were a lower number of arrests overnight and in the last few days here in the city?
We're monitoring the lockup list. I think the expansion of the citation release is definitely going to have an impact to ensure that those numbers are lower. The idea is to introduce fewer people over at the courts who are right now they're strained because of they had a COVID-19, as you know, positive hit over there.
Chief, while you're there, just 2 quick questions. Does your positive test for MPD extend to cadets and anyone else in your universe?
We're monitoring all of our sworn and civilian personnel. That would include our cadets. So we've had 15 people who have met with medical professionals who have ordered them to take tests. Out of those 15, 2 are negative and 13 are pending.
So how many officers do you have quarantined?
We haven't quarantined any officers. Some officers have self-quarantined or quarantined based off of advice from medical professionals.
How many is that?
It's around 70.
Chief, the criteria for the officers to issue a citation or make it what is that?
It's very detailed. I mean, if you want, I don't even know if we would share that with you. If we can share it, we'll make it available.
Chief, last question. Have you seen an uptick in calls for domestic violence since the self-quarantine at home, people staying home and whatnot?
So a lot of people have insinuated that that's something that could potentially happen. At this point, we have not seen an uptick. We're also monitoring, obviously, crime very closely during this emergency. We have not seen noticeable fluctuations in any category of crime as of yet.
Question?
Chief?
Go ahead.
Yeah, just a quick question. Do you believe that testing should be a priority for officers?
I'm going to have the Dr. Nesbitt answer the question about testing.
So from our perspective, we have paid attention to what is happening with first responders. Our priority is making sure that we focus on prevention, as Chief Newsham outlined in his remarks, as well as Chief Dean. The goal is to focus on how we are interacting with the public. Those things focus on as early as January, how our first responder community here under the leadership of Chief Newsham and Chief Dean have been very instructive to members of both MPD and DC FEMS in terms of how to interact with the public, the Office of Unified Communications doing screening for them preliminarily, and then encouraging the use of personal protective equipment initially. It is not the policy to do asymptomatic screening of any member of the community, regardless of their risk category.
Question? Yep, go ahead.
Yeah. Okay, and following up on that for testing, so I assume that also applies for doctors. I'm thinking about UMC now. One doctor tested positive. Are any tests pending for any doctors?
It is possible that healthcare systems may have physicians who they are monitoring who may have had a healthcare personnel exposure within their health systems who have tests pending. DC Health is not the exclusive tester or approver of testing in the District of Columbia. So I am not able to speak affirmatively to that.
Just kind of curious about the public health lab. We hear that the lab can test up to 50 patients. I mean, the numbers in the past few days have showed fewer than 50 tests pending. So my question is the lab up to capacity? And if not, why isn't it up to capacity, particularly because there's demand for testing and they can turn around tests pretty quickly?
A number of healthcare providers in our community have opted to use commercial laboratories for testing. And because they are using commercial laboratories for testing, healthcare providers across the district could be sending tests to any of the number of commercial laboratories. We also have health systems in the district who are using commercial laboratories affiliated with their health system. So the DC Public Health Laboratory is not the exclusive laboratory providing testing in the district.
It's hard to hear. It's hard to hear up there.
I can't hear you, Jerry.
So, what has been the conversation around tending those with the coronavirus as well as those with other chronic illnesses? You know, as far as overwhelming the public health system in DC. What has been the conversation around tending to those with the coronavirus as well as those with other chronic illnesses, just given the fact?
Yes. So we have had several conversations with the healthcare providers in our community, including a webinar today, focusing on primary care providers and other outpatient service providers in terms of how to responsibly continue to provide healthcare services to others who may need it, who are not seeking services related to COVID-19. We have done a number of things, those in particularly in the policy realm, to ensure that individuals with chronic health conditions can continue to receive the care that they need. The Department of Healthcare Finance, which includes the state Medicaid agency, has taken decisive action around increasing the availability of telehealth services, such that individuals who have chronic health conditions do not necessarily have to go to their healthcare provider to receive the health services that they need. There have also been decisions made around access to medications so that individuals will have the access to the medications that they need. A number of our health systems and hospitals in particular are implementing triage processes where individuals who are going to the emergency rooms will be immediately triaged and separated when they have a suspicion for COVID-19 versus individuals who are going for other health conditions. That's also happening in our primary care practices and other medical practices to decrease the likelihood that individuals with chronic health conditions and those who are immunocompromised will come into contact with individuals with COVID-19. And so we've been doing a lot of messaging and education around that with our healthcare providers.
Are you
considering ordering DC residents to shelter in place?
We continue to follow the science, look at our numbers on the ground, and make the best decisions for DC. And we have all options on the table as the situation evolves. I talked to you about what our numbers are in DC and how our team of doctors is following the trends in Washington, and we'll make decisions based on that. Yes, Lou.
Yes, Mayor. In terms of the unemployment situation, I'm hearing from some of the just unemployed nightlife and hospitality industry workers that they're having trouble, many of them, in applying for the unemployment online on the system because they're saying the online application forms have not been updated, and it's not allowing for the new provisions that you put in place for people that normally may not be eligible?
Well, Lou, as I mentioned, 7,600 people have already applied. And so let me just, we've heard that some people have tried to use mobile devices, and the application does not support a mobile device. You'll need to be at a desktop. And I'm told the best system is the Internet Explorer for ease of use with the application. But more than 7,000 people have already applied.
Whether, though, they have been deemed to be eligible?
Well, the review process happens once the applications go in. We have our teams of people. Actually, we have added more resources at the Department of Employment Services to do the reviews that have to be done. We have some technology things that we also have to do to remove, for example, the waiting period that is typical in an unemployment claim that we're trying to remove, but we have to make some changes to technology. So all of those things we will be advancing. Yes, Washington Post.
Sure, I'm just kind of curious. I mean, do you see these social distancing measures, I mean, the public health emergency, the restrictions on the restaurants and so forth, are they extending into April?
We don't know. It's certainly possible because what I'm being advised from our public health professionals is that we want to see the slower spread before we know for sure if those social distancing measures are working and when we're at the end of them.
Are you considering any action as far as releasing certain populations of inmates from the jail?
No.
Not at all?
I answered you. Yes.
What does transparency look like in this time in regards to the D.C. Council? I know there was some talks about teleworking and all that. Would you mind clarifying that?
What are some of what does transparency look like?
As far as just us seeing council meetings and...
Oh, the council. Oh, thank you for mentioning it because I do want to give my appreciation to the D.C. Council. They met on Tuesday to pass a piece of emergency legislation. I think it has about 26 different measures that are going to help the D.C. government operate more smoothly during this time of emergency, but also is extending some deadlines. For example, a number of residents are concerned about expiring driver's licenses or motor vehicle registrations. We have extended all of those deadlines and they will be in place throughout the emergency. So you have no need to go down to the Department of Motor Vehicles. Likewise, they have extended expiration dates related to public benefits like SNAP and TANF. So if your eligibility is expiring, we have already automatically extended those dates, and you have no need to go down to the Department of Human Services. So though that emergency piece of legislation, I signed it that evening that they voted on it, is in effect now. Now, I do understand that many people are used to going down to the council during this time to talk about our budget, and we have extended that budget submission timeline in hopes that by the time we submit the budget, that the council will then be able to reconvene in regular session so people can go down and testify about the budget. I understand too that they gave themselves the ability to meet virtually in the emergency legislation because there may be additional things that we need to go back to them before they go back into regular session for a vote, and they will have the ability to do that virtually if necessary. Yes. Yep.
Chief Dean?
What's your question?
Chief, do you have any AMR personnel who have either tested positive or are in self-quarantine?
Yes, we've had AMR that have run some calls with us that we've notified them to that our member tested positive so they could be evaluated by the health department. I do not have the number.
Could you give us the condition of the people?
The large number of firefighters you now have on self-quarantine, and I think you indicated that's going to go up. Do you anticipate possibly having to use mutual aid?
At this time, no. What we're doing is we have contingencies, and we're looking at all the contingencies from how we're deploying our resources, how many resources we have, and that. But we're not at that stage that we have 141 members out of a over 2,000 member department right now that we're working through. But we continue to meet daily to talk about what our plans are and what we're doing.
Could you tell us about the condition of the three that are out? What's their situation?
So they tested positive for the virus. I cannot tell you they're all at home. They're resting, and a doctor has been talking to them on a regular basis.
And you said 141 you're working through. Does that mean the people that are off as a result of contact with those three?
Yes, according to they're being monitored by DC Health because they were exposed.
Do you know how many patients are being contacted who may have come in contact with at least the first two firefighters you knew of?
I don't have the number with me, but yes, we've gone back over the incident numbers, and we've gone back and given that number to DC Health to contact them also.
Can you tell us, did the first firefighter, did he self-report before he got a test positive? Or when did he first self-report? At what point in his timeline is he self-reported?
When he was off duty, he went to the doctor, and I think that's when he got diagnosed and we got notified.
That was before he got the test result, right?
Correct.
Will drive-through testing be available in the district soon?
We continue to explore having kind of a central testing site, and we are going to work now that we have National Guard assets to help us with planning that. But what will be critical is if we get federal assistance with supplies. And if the federal government is not going to do the testing, we want the ability to be able to do the testing, but they have to provide the supplies.
Do you see a quarantine being imposed soon?
I've answered that question already, yes.
About 39 patients who've tested positive as far as their health status or any critical condition? Or
I cannot. I don't know if Dr. Nesbitt can. The stage give a, I don't know how much of that we're going to discuss.
Right. Okay.
Moving forward, we are going to start reporting the individuals who are in various stages of recovery, individuals who are recovered. There's an official process that people go through, as well as providing demographics at the aggregate level. So what proportion are women and men and of different age groups. As the numbers increase, we're able to do that with a little bit more privacy protections.
One other last question about hospital bed capacity. I'm wondering, are you concerned about that, and what options are available as more people get infected? I know Harvard came out with an estimate that a lot of folks are,
Yes, so we're in constant communication with our healthcare provider community. As people have been heeding the message of working through their healthcare providers in lieu of showing up to the emergency department or activating the 911 system, as Chief Dean mentioned, our hospitals are able to look at their surge capacity in a much different way. All of our hospitals have been working with us collaboratively since late December, early January, and reimagining how their hospitals could be utilized in the event that we have more critically ill patients who require ventilators, and looking at how their ICUs, intensive care units, could be used. We have been in constant communication with their hospitals. We've given them information in terms of how we would, under a public health emergency, look at the city's licensure and regulatory requirements for our healthcare system, and how we would be working collaboratively with them to have flexibility within that licensure and regulatory infrastructure. Some of our hospitals have already asked for us to come out and use that flexibility within the licensure and regulatory process, as long as patient safety and quality can be maintained.
Are any plans being made right now to extend school closure past the original 2-week timeline?
As I mentioned with the earlier question, we haven't started talking about what our April operations look like yet, and when we're ready, we will start talking about that. Yes.
Muriel Bowser, could somebody update us on reports from Rocket Ship Rise Academy that an elementary school student has tested positive there?
Yes. So I think that it was reported, fortunately, based on some misinformation. And the student evidently was not tested yesterday and did not receive a positive result. We have directed the family to go back to the medical provider and seek a test. We understand that test has been made and the results are pending. So we will not be reporting any positive results of a minor tonight. Yes.
Sorry, one last question. I forgot to
Yes.
ask, but I apologize. I keep having to walk down again and again. Just kind of curious in terms.
Well, we practice social distancing.
In terms of supplies, I mean, with your conversations with hospitals and medical providers, what are you hearing in terms of shortages? Because nationwide, there's been shortages of a bunch of things in terms of what your medical providers need. But have you, are you hearing any shortages from your conversations with them?
Well, I'm sure you would imagine that the District of Columbia is not immune to any of those conversations. We wouldn't be any exception to what's happening against the national backdrop. What our responsibility is as a government is to constantly assess what the healthcare provider community's needs are as it relates to the personal protective equipment, access to the swabs that are needed to be able to do the samples in the doctor's office, and then for those health systems that want to develop their own laboratory tests and make testing available to patients, what types of reagents or support that they would need. What we have been able to do thus far is we have been able to make requests to what's called the Strategic National Stockpile that only governments can access. When we do that, we do a survey of what our healthcare providers need so that we can make a request that would potentially allow us to help the healthcare providers in the district. This week, we are making an allocation to some of our private providers and outpatient providers of surgical masks out of that Strategic National Stockpile allocation. But up to this point, we have not received any requests for any other equipment. We have been able to get a gauge from some of them that they do anticipate that they may have an imminent need or a need in the next few weeks for more of the swabs and things of that nature. So we will be leaning forward and making those requests as well.
Yes, ma'am. In terms of, again, the hospitality industry and nightlife industry, some were saying now that the program that I think you announced the other day about grants for some emergency financial support hasn't actually kicked in yet. Is there a timetable for that?
No, we are developing it now. I think you can imagine we've been working on it since late last week. The council authorized it on Tuesday, and we continue to work on eligibility application funding to to make sure that we can fund the programs. It was authorized but not funded, so we're looking at all of our sources in the current budget to see what we can do to help our small businesses recover. Yes, I'll take a couple more. 1, 2, 3.
This question is for the police chief.
Yeah.
If you don't mind. Just want to double check. Did you say that no officers have been quarantined? I didn't hear you quite, Chief.
What was your question?
In terms of any NPD officers being quarantined, just wanted to double check that.
Yes, no NPD officers have been quarantined. I think the chief mentioned that a number of them have consulted with their doctors and are kind of in a self-quarantine status, but nothing based on any positives from NPD workers or officers, and nothing ordered by the Department of Health.
I mean, I'm wondering at what point can this become a staffing issue, right? If you have officers who may be sick, or maybe with the virus, or maybe self-quarantine, what point do you foresee it being a staffing issue as this crisis
We're
continues?
just going to monitor the staffing on a day-to-day basis, watching it very closely. Right now, it's not impacting staffing at all. We have the capability for full police service. We also have the ability to use overtime if necessary. So, if it gets to that point, we get to that point. Right now, we're not even close.
Neighboring jurisdictions have limited mass gatherings of 10 people or less, and the CDC is recommending that. Is that something you're considering? And if not, why not?
We want everybody to stay at home if they don't need to be out. And I think when we start talking about, what are we at, 25, at 50, we can update it, but we don't want anybody gathering. And actually, you all are sitting too close. So that's where we are. Yep.
So if I could sneak 2 quick ones in. One, you mentioned Governor Hogan. He's urged everyone to stay off of public transportation except for first responders and whatnot. Do you agree? Do you make that same call to action? And another, there's been anecdotal talk about people going to banks and being restricted as to how much cash they can pull out. Have you talked to the banks? Have you heard that? Or do you have that concern that people may be having trouble getting money out of banks?
I haven't heard that. And I've asked our CFO to have a number of conversations with banks, including the district's operations, and we're talking to banks also about being a part of our recovery effort. But we haven't heard that. And as it relates to Metro, I did talk to Governor Hogan today about our regional issues and how critical Metro is to us. I agree with the general manager's approach to scaling down service as it relates to ridership. Thank you, everybody. And we expect, hopefully, to talk tomorrow a little bit more about some things that we will have in place to help our businesses recover. Thank you.
We now return to our previously scheduled program, already in progress.
And love for one another. And once all the cameras turn off, how do you feel about care and love yourself? And that's why I'm here today. I'm a student at